o'clock in the morning. Expect temperatures to be dropping and the winds to be picking up.
Elise, thanks. Back to the coronavirus concern, and while many people might be concerned about actually getting sick, there's another way it could affect your health without you being exposed to the virus. Believe it or not, the coronavirus could lead to shortages of important, even life-saving medications. Dr. Max Gomez joining us now with more on how coronavirus could lead to disruptions in the drug supply in the country. Max?
That's right. You know, Dana, it's because many of the raw materials that go into the drugs we take here in the States actually come from China. It's both for prescription and over-the-counter drugs. Now, while the final manufacturing of the drugs may take place in the U.S. and Europe, it's the raw materials for these drugs, the supply chain, that's being disrupted because the production facilities in China, as well as shipments from China, those have all been locked down. So that's what's causing these shortages or potential shortages.
So when you talk about a disruption, how widespread?
We should emphasize, first of all, that we haven't seen any drug shortages yet. Drug manufacturers are obligated to tell the FDA when they anticipate supply disruptions. So far, the FDA says they've been notified of a shortage of just one drug related to corona disruption, which they did not name, but they said they are working to mitigate that shortage. The FDA has been in touch with 180 manufacturers of human drugs to check on their supply chain. They also said there are 20 drugs that the FDA has identified which solely source their ingredients from China. So the potential for shortages is actually quite large.
So what drugs specifically, if you can just give us a handle on, what are we talking about here?
Yeah, they don't want to name the actual drugs exactly here, but all sorts of drugs and classes of drugs are potentially affected. They include antibiotics, diabetes drugs, painkillers, blood thinners, antivirals for HIV, and even some cancer drugs. And interestingly, they're not just the active ingredients in the drugs. Much of the so-called inert ingredients in a drug, those can come from China. Fillers, stabilizers, antimicrobials to keep the active ingredients safe, they are all important in the effectiveness and bioavailability of a drug. So all of those are could be part of the shortage.
But you would think there would be a supply in stock by the manufacturers to get, you know, to the companies to make them, the drugstores and the whole thing.
Well, you know, they keep a certain amount, but to keep costs low, they don't stockpile huge amounts. Most of the drug companies we're told keep about a 4-month supply on hand. So they should have enough on hand for now. But we're only about 2 months into this disruption. If it goes on much longer, we might actually start to see some shortages.
So what do you do? What is the manufacturers, the FDA?
Yeah, this is a tough question.
Sounds tough.
Part of the issue is that manufacturers, understandably, have turned to the lowest cost suppliers for the raw materials. They may need to start to develop alternative sources for the materials, redundancy from other countries or other suppliers, if you will. The FDA says it could lengthen expiration dates on some critical shortages without affecting safety on the drugs too much. But most of the solutions really involve requiring stricter reporting of supplies on hand and to develop risk management plans and strategies. They're going to have to source some of these supplies from other manufacturers.
It's a lot to put your head around if you're already thinking about the virus. What can a consumer do? Anything?
Not really much when it comes to these drugs. If you have drugs that are really important to your health, diabetes drugs or something, it might be worth trying to keep as much on hand as possible. The problem there is insurance companies won't often let you buy more than a 30-day supply or sometimes a 90-day supply. But it's possible that you could make some sort of an appeal to them, although the insurance companies will probably say, well, we'll worry about that when the shortages come around. But that's one possibility. If you can, stockpile some stuff on your own.
So today on CBS 2 at 5, you'll be talking more about this?
Exactly. We're going to talk to one of the experts on supply chain and some of the potential shortages here, and they'll fill us in on more of the things that we can do.
All right. Dr. Max Gomez, thank you. Stay with us on CBSN New York for continuing coverage of the coronavirus outbreak. On our website, we have links and information from state and local officials, plus the Centers for Disease Control. It's all at cbsnewyork.com. Time to look at our trending stories this Tuesday. James